Good morning and welcome to Physical Therapy 102. This course is Heart Failure, Considerations for the Physical Therapist. I'm your instructor, Sharon Richmond, and before we get started, I would just like to tell you a little bit about my background. I'm a licensed physical therapist. I predominantly worked in the hospital setting in on all the floors, and also in the outpatient and aquatic therapy departments. I've worked with patients with all kinds of diagnoses: orthopedic, neurological, cardiac, pediatric, people of all ages. And I became interested in heart failure for various reasons, which I will discuss in a moment. And this course will focus on heart failure, the physical therapy, treatment, assessment, and education of patients with heart failure. It is also very useful in educating patients who may be at risk for developing heart failure. And this first week, we will be going over what you learned last semester or several semesters ago, depending what year you're in, we'll be reviewing what you learned in human anatomy and dissection anatomy related to the cardiovascular system. So we'll be going over anatomy and physiology of the cardiovascular system. It should all be review, but we will go at a good pace. Okay, so many of you may be asking, why as a physical therapist do I need a whole course on heart failure? Why not just one course on cardiovascular disease? And that's a good question. Probably mainly because I have a specific interest in heart failure. I have several relatives who have heart failure, and I've helped them with their lifestyle planning. And but heart failure really is very pertinent to physical therapists, because my story is that when I was working in the hospital, I would take a very good detailed medical history of my patients. If they were in the inpatient side, I would look at their medical history. And as I started to treat these patients over the years, I realized that almost all of them, if not all of them, had at least one chronic disease they were living with. I mean, I worked in an area that was very underserved. Diet was not very, people lived with a very fatty diet, low on the fruits and vegetables. People were, a lot of them were overweight. And so most of my patients had one chronic condition, usually diabetes and hypertension. But there were other diseases that also were pretty common. And as I learned more about heart failure, and as I got more relatives who had heart failure, I realized, gosh, all my patients are at risk for heart failure. And what if we could do something to help these patients, not only when they develop heart failure, but also to educate them about how their lifestyle is causing these predisposing conditions and in turn causing heart failure. So if you look at the slide, you can see all the conditions, well, most of the conditions that make a patient predisposed to heart failure. We all know most of our patients, if we work in the hospital, acute floor, a lot of them have hypertension, diabetes, some have cancer or have been in treatment for cancer. They may have HIV or AIDS. They may have a history of alcoholism or other substance abuse. Some have congenital heart disease, heart valve disease, coronary artery disease. And these conditions predispose them to cardiomyopathy. And cardiomyopathy just means damage to the heart muscle. It could be that the heart muscle has become enlarged, hypertrophied, and it's not pumping as well, or it could mean that the heart muscles become stiff. Cardiomyopathy causes heart failure. The heart is not able to pump blood efficiently. So now the patient has heart failure, and they have the predisposing conditions, and the heart failure causes further damage. So on top of diabetes and hypertension, now they have the risk of developing liver and kidney damage, further heart damage, and they also are at risk for stroke, because they may have an arrhythmias when the heart is not beating in the way that it should. So I thought, wow, you know, if I learned more about heart failure, learned more about what it looks like, you know, what the symptoms are, I could educate my patients on how to monitor their health, you know, to monitor their symptoms and know when to go to the doctor, how to improve their lifestyles. And I thought that I would share my knowledge with you all in this class focused on heart failure. And I hope that as we go through the course, you will also, you know, also value this information and be able to use it with your patients in the future. As I said before, this week we will be reviewing cardiovascular anatomy and physiology, and our learning objectives for this week are that you will be able to describe the flow of blood through the heart and the vascular system in the appropriate order. You will be able to describe the role of the cardiac conduction system, the parts of the cardiac conduction system, because the heart does, as you know, run on electricity, and how that can cause the contraction of the heart. You will be able to look at a diagram and be able to identify the various anatomical parts of the heart and the vessels and the conduction system. So just for a quick overview, I'm sure all of you know this, but the flow of blood, if you start with the body uses up the oxygen, and the deoxygenated blood will come back to the heart through the right atrium. The right atrium will pump the blood into the right ventricle. The right ventricle will pump the blood to the lungs, where the blood will get oxygenated. Now the oxygenated blood will come back to the heart, to the left atrium. The left atrium will pump the blood into the left ventricle, and the left ventricle will pump all that nice oxygenated blood to the body. Okay, so on this slide you can see we have a very nice diagram, very clear diagram of the heart, and it shows all the valves and the blood vessels and the chambers of the heart. So here we see, as I was saying, the deoxygenated blood comes into the right atrium through the vena cava. So we have a superior vena cava, which brings the blood from the upper body, and the inferior vena cava, which brings the blood from the lower body. It goes into the right atrium, and then the right atrium will contract and push the blood into the right ventricle. Now here we have the atrioventricular valves. The right side of the atrioventricular valve is called the tricuspid valve. Okay. All right, so now their blood is in the right ventricle. The right ventricle will pump this deoxygenated blood into the pulmonary artery. Note that it's unusual, but the blood that's usually the arteries carry oxygenated blood, while the pulmonary artery carries deoxygenated blood. So that's that sometimes confuses people. And here you have the valve. The valves it opens and closes, it prevents the blood from backflowing into the chamber. So here you have the semilunar valve, or it's also called the pulmonary valve. So it's semilunar or pulmonary valve into the pulmonary artery, and the blood goes to the lungs to be oxygenated. Okay. Please note that the next part that I'm going to talk about, the two parts will occur at the same time. So both right and left atria will fill at the same time. They'll pump into the ventricles at the same time, and the ventricles will contract at the same time, pushing blood through the pulmonary artery and the aorta at the same time. Okay, so let's go back. The blood gets oxygenated at the lungs, and then the blood returns. The blood returns through the pulmonary vein. So you can see there's pulmonary veins on both sides, and this is also interesting because the pulmonary veins usually carry deoxygenated blood. Well, in this case, they're carrying oxygenated blood from the lungs. And then the blood goes into the left atrium, and the left atrium will pump the oxygenated blood through the atrioventricular valve, what's also called the mitral valve, into the left ventricle. And now the left ventricle is filled with oxygenated blood, and it contracts to pump the blood to the entire body, and it goes through the semilunar or aortic valve into the aorta, and then the blood goes to the various organs and muscles as needed. Now you'll notice that the left ventricle has a much thicker muscle wall than the right ventricle, and this is because there's a lot more pressure to push. It requires a lot more pressure to push the blood to the entire body rather than just to the lungs. So here you have an image. We're going to talk about the heart conduction system. We all know that the heart operates on electrical impulses, and there's a specific pathway that this electrical impulse needs to travel. Otherwise, patients will get what's called arrhythmia, and we will be learning about that in future lectures. So the contraction starts at the SA node, or sinoatrial node. And the sinoatrial node is sort of like the natural pacemaker of the body. It sets the rhythm or the intervals of how fast and when the heart's going to beat. Okay. So the sinoatrial node will be stimulated and send an electrical impulse and cause both atria to contract. The electrical impulse will travel to the AV node, or atrioventricular node. There's a brief delay. Okay, so all the blood has to be pumped. So the SA node causes the atria to contract and pump the blood into the ventricles. Remember, I said that both atria will contract at the same time. And after the blood has all been pumped from the atria into the ventricles, and the atria have started to refill, the AV node will be stimulated. And then the electrical impulses travel through the remainder of the pathway. You've got the bundle of His over here. You have the left and right bundle branches over here, left and right bundle branches, and the Purkinje fibers all the way down here. And all these offshoots cause the ventricles to contract. Okay, so we're going from sinoatrial node to the AV node to the bundle of His to the left and right bundle branches, and then to the Purkinje fibers. And this allows the heart to contract in a coordinated fashion, because you want the atria to contract together, and then after that, after the heart's filled, after the atria has pushed all the blood down into the ventricles, then you want the ventricles to contract. You don't want the ventricles to contract prematurely or not at all or too quickly. And so this is a very sophisticated electrical system that controls how and when the heart contracts. Okay, so if you have any questions, you can raise your hands and we can answer any questions. No? No questions? Okay. Okay, so we're going to be doing just a cooperative learning quiz. This is going to help you, it's going to help me assess what you've learned, and also it's going to enhance your learning because you're going to be working in pairs. So you're going to pair up with the person to your left, and you take turns asking each other the questions. You'll answer 2 questions each. Sort of review your answers, make sure that you're okay with the answers, write them down, and then hand it in to me at the end. The pictures on my desk, you can pick them up and answer those questions about the illustrations over there on the diagram. You can draw on the diagram. The questions. Describe the flow of blood through the heart and its vessels in the appropriate order. On the illustration, show your partner the heart chambers and blood vessels. And then the last two, same illustration. And what is the role of the cardiac conduction system?